Hello, everybody. This is Kobe Pope, owner and creator of Wolf Self Care Products. Happy Mag Facts Monday. Today, we're talking about magnesium in regards to asthma and cystic fibrosis. Three things we need to know about magnesium and asthma. Number one, research shows that many patients with asthma or other bronchial diseases have low magnesium. Number two, many drugs used in the treatment of asthma cause loss of magnesium only making symptoms worse. Number three, patients treated with simple magnesium supplementation report marked improvements in their symptoms. All right, asthma is characterized by bronchial spasm, swelling of the mucous membranes of the lung, excessive mucus production, and an inability to fully empty the lungs of air. Asthma finds its easiest victims in children under 10 and is twice as common in boys and men, although it affects about 3% of the general population. Okay, talk about a variety of stimuli, including lung infection, exercise, emotional upset, food sensitivities, inhalation of cold air, or irritating substances like smoke, gas fumes, paint fumes, chemical fumes, and reactions to specific allergens such as pollens. The allergic triggers called allergens initiate a release of histamines in your body, which try to eliminate the allergens by stimulating lots of mucus to mop up the allergens and push them out through sneezing, coughing, and watery eyes. One of the side effects of too much histamine is tightening of the bronchial tubes, which go into spasms. Such spasms can initiate episodic wheezing, coughing, and shortness of breath, which can quickly lead to rapid breathing, difficulty exhaling, anxiety, and dehydration. The anxiety of an asthma attack can create crippling fear, the sense of the whole body. Bronchial spasms are worse in magnesium deficient patients because there's not enough magnesium to relax the smooth muscles of the bronchial tube. So the more magnesium deficient you are, the more allergic reactions you may experience. Antihistamine enzymes in the body used to control the overproduction of histamine. However, they require magnesium, copper, vitamin B6 for them to work properly. Many asthma inhalers are fluoride compounds, and the fluoride may bind to magnesium, making it unavailable to the body. Magnesium treats asthma. It is a bronchodilator and an antihistamine, naturally reducing histamine levels in the body. It has a calming and dilating effect on the muscles of the bronchial tube that go into spasm during asthma attack. According to Dr. Mildred Sieg, drug treatment of asthma consists of magnesium wasters such as beta blockers, corticosteroids, and Ventolin. The side effects of these drugs can include severe magnesium deficiency, which can result in arrhythmia and sudden death. Childhood asthma, European study, group of children had 31 asthma patients aged 6 to 18 were deteriorating on conventional treatments. One group was given magnesium sulfate, another group was given saline solution both intravenously. At 50 minutes, the magnesium group had a significantly greater percentage of improvement in lung function and more magnesium patients than placebo patients were discharged from the emergency department and did not need hospitalization. Patients who had lower cellular magnesium levels had increased bronchial spasms. The lack of magnesium was probably the cause of this condition. Magnesium deficiency is surprisingly common, finding it in 65 of an intensive care population of asthmatics and in 11% of outpatient asthma population. Magnesium has several antihistaminic actions beyond being an antihistamine and bronchodilator. It also reduces airway inflammation, inhibits chemicals that cause spasms, and increases anti-inflammatory substances such as nitric oxide. The same study established that lower dietary magnesium intake was associated with impaired lung function, bronchial hyperactivity, and an increased risk of wheezing. The study included 2,633 randomly selected adults ages 18 to 70. Investigators concluded that low magnesium intake may be involved in the development of both asthma and chronic obstructive airway disease. Dietary advice for asthma: eliminate alcohol, coffee, white sugar, white flour, gluten, fried food, trans fatty acids found in margarine and baked. Okay. Limit red meat and dairy. Eat animal protein, of course. Grass-fed, free range for vegetarian protein, fermented dairy, lactose-free cheese. Vegan protein choices include legumes, gluten-free grains, nuts, and seeds. Healthy carbs include raw, cooked, and fermented vegetables, increased yellow vegetables, and green leafy vegetables. All right, it's a whole list that goes on. Pretty much stuff I've been saying in previous episodes to help with magnesium. Okay, other measures that relate to, okay. Avoid aspirin and non-steroidal anti-inflammatories like ibuprofen, which can cause allergic reactions. Clean up environmental allergens. If you can't part with them, find other homes for cats and dogs. Remove all the wall carpeting, wall hangings, and feather pillows. Frequently replace or clean air filters for heating and cooling systems. Obtain environmentally sound cleaning products. Use a vacuum. Okay. Since yeast overgrowth may be related to asthma, okay. And boom, that is all I got for you guys. Thanks for watching. Happy MagFacts Monday. You know where to shop the best supplements. www.blfclfcre.com. Shop me, I got you. Peace.